Thank you for tuning in. In this video, I'm going to talk to you about the stages of labor. It's nice to know what to expect, even though, there are a lot of variations in how labor and birth can go down. I'm going to give you some figures and ranges, but just take this all with a grain of salt. Dilation isn't always an indication of progress or time left. So this is, of course, just for educational purposes only. Very first thing is that there are 4 stages of labor. In the first stage, there are 3 phases, and I don't want you to get confused about that. Stage 1 is dilation and effacement. That is when your cervix is going from 0 centimeters dilated, not dilated at all, 0% effaced, so real nice and thick, how it's been for all of your pregnancy, and then it to 10 centimeters, which of course is complete. This is when you're in actual labor. Like I said, there are 3 phases to this stage 1. The latent phase, active labor, and transition. Latent labor or prodromal labor or early labor is when you're dilating up to 3 centimeters. And this can last, this can last weeks sometimes. I know it did in my 2nd and 3rd pregnancies. But early labor, prodromal labor, latent labor, you'll hear false labor, although I really discourage that kind of language because you're definitely in labor. Your body is doing a lot of warming up. You're having contractions every 5 to 30 minutes. Sometimes you will stop having contractions altogether. They last anywhere from 30 to 45 seconds at a time. They might be mild, kind of annoying. The best coping mechanisms for this phase of labor is really just distraction. I say, put on a funny movie, go for a walk, take a nap if you can find a comfortable position. Really kind of do whatever you can to take your mind off the fact that you are having contractions. Now, of course, as first-time parents, we can get really caught up in measuring and timing our contractions, and it can be a really exciting time. And sometimes, we overreact to these contractions as well, because they can be really intense if this is a new thing for you. So what I would say too is just try to stay home or go out to eat, go to a movie. The biggest mistake I would say that most first-time parents make in this early stage is going to the hospital too soon. What will likely happen, either one of 2 things will happen if you go to the hospital during this phase of stage 1, is they will either put you on the monitor and discharge you home because you're not dilated very much, or they'll keep you there and you'll be induced somehow. So I definitely say if your goal is to have as intervention-free or drug-free of a delivery as possible, to stay home during this stage if you can. Then phase 2 is really when things start heating up, start warming up. Phase 2 is active labor. That is, there's a transition between 3 and 4 centimeters when you're getting into active labor. A lot of parents can go through something sort of like an anxiety, when things start getting a little bit more intense. You realize that there's no backing out of this now, that you're actually signed up for good. That is where we often see people, opting for an epidural or hitting a wall. But active labor is where things do get more intense and the contractions that you have get longer, stronger, and closer together. Contractions will last between 45 and 60 seconds very typically. They'll be between 3 and 6 minutes apart. This is where you're going to want to get into those rituals that you've planned during pregnancy. And then definitely, take those rests in between your contractions. It's so important to do to get through this phase of labor, which can last anywhere between, 2 and 4 hours to 18 hours, like my first baby did. Active labor can vary very widely in length. And then this last phase of labor is transition, and that is when you hit 7 centimeters to 10 centimeters. The cervix is dilating completely. It crests around baby's head. This is very, very intense. Sometimes contractions are piling on top of each other at this point. Feels like a freight train. I mean, it's very, this is like a lot of people's come to Jesus moment in labor, where they realize what they're capable of. If you haven't had any drugs on board, you might be begging for them at this point, or just really like having to dig deep for those last moments of strength. And transition can last anywhere between, I had a 4-hour transition with my first baby, long labor, to 30 minutes. Sometimes transition can happen very, very quickly. It just depends. Subsequent births tend to go a little bit more quicker. And these contractions, like I said, they can pile on top of each other. They can be, 1 to 2 minutes apart, and usually they're about 60 to 90 seconds long. Very, very intense. And your provider will probably, and your nurse, if you have one present, will be feeling your uterus for the strength of your contractions. And your body is just like, your uterus is it's just getting hard at this point. You can actually feel the uterus get really, really rock hard because of how intense these contractions are. So that is stage 1. Stage 2 is actual pushing. And that's when, between the points where you're actually fully dilated to the birth of your baby. There can be kind of a lag time between stage 1 and stage 2, because as your baby descends into the birth canal, a bunch of room gets created at the top of your uterus, and it takes a little bit of reorganization of your uterine muscles from pulling up and effacing that cervix to actually pushing down on baby. So that's where I hear a lot of women say that they didn't ever feel the urge to push. Well, sometimes we just didn't wait long enough for that urge to push to come because of that space and that reorganization of uterine tissues for effective contractions to actually push baby out. So stage 2 is pushing, and I would say it's more, I like to call it the descent of baby, because not everybody pushes, not everybody feels the urge to push, and sometimes pushing isn't necessarily necessary. But if you've had an epidural, you'll be guided to push in this stage of labor. And this can last anywhere from 2 minutes to 2 hours. Really, of course, it depends. Stage 3 is birth of the placenta. This is somewhere around 30 minutes. Hopefully at this stage, you've got baby skin to skin, you're starting to initiate nursing, your uterus is starting to clamp down really rapidly to birth and expel that placenta and start clotting off. And then when your placenta is delivered, you've got stage 4, which is immediate recovery. And that is when you get your fundal massage, which is so fun and lovely. Stage 4 is when you're really focused on breastfeeding your baby, voiding your bladder, getting, some sugar replaced. You've got a lot of attention on you and baby in that birthing room. And then depending on where you've given birth, you're either going to discharge home from the birth center or get transferred into your postpartum suite or get settled into bed at home. So those are the stages of labor. I hope that really explained kind of like an overview of how it goes, quick and dirty, a great resource that goes in a little bit deeper to like comfort measures. Some of the emotions that come up in each of these stages is definitely Penny Simkins' The Birth Partner, which I don't have my copy of here with me, but I relied on heavily just to kind of freshen up because it's been a hot minute since I've been to a birth. Let me know what questions you have. I can't wait to see your comments and questions below this video, and we'll talk soon.